I'm David Bobbitt, and I want to show you the AATS Quality Gateway Thoracic Core Risk Calculator. It's at thoracic.aatsqualitygateway.org. And so when you come onto the homepage, you'll see a traditional risk calculator on the left where you can fill out fields. There are 37 essential fields noted on the screen. However, on the right, there's an AI assistant. Now, you can hide the AI assistant or you can make the AI assistant available. First, I'm going to show you the voice control version of the AI system. So if I scroll down here to the bottom, there's an area to paste in information. I'll show you that second. But the first area I'll show you is this voice control. I press the microphone button once, it'll turn red, and I speak any information I want about a patient that I want to see a risk assessment for. Let me show you. The patient is a 70-year-old male former smoker with a 15-pack year history. He's 161 centimeters tall and weighs 78 kilograms. He has a medical history notable for hypertension, but no history of coronary artery disease or chronic immunosuppressive therapy. He has an ASA classification of 3 and maintains excellent functional status with an ECOG Zubrod score of 0. Clinical evaluation identified a 3.5 centimeter tumor. It was staged as CT3 NOMO, indicating locally advanced primary tumor without evidence of regional lymph node involvement or distant metastasis. He's been on preoperative chemotherapy as a neoadjuvant. He is intended to receive right side single lobe lobectomy. It's an open approach. There is no intended pneumonectomy, wedge resection, or chest wall resection. As far as his organ function and labs, pulmonary function, FEV1 is 95%, DLCO is 84%. Hemoglobin is 11.9, and creatinine is 0.85. Now I press enter, and that information, which has been recorded, appears in the AI assistant, which then fills all the fields on the left just as if I'd typed them in. I'm going to scroll down a little bit and you can see there's a composite overall morbidity and a 30-day mortality estimate. If I click on the left chevron, I can see some graphic representations as well as the data. The average patient in AQG for this particular profile, this particular procedure would have an 8.02% composite morbidity risk. This patient is higher risk, 13.59. There's a dot plot on the left that can kind of show you it graphically, or you might want to show that with a patient, and there are other graphic elements in the center and the right reflecting risk. Now, 30-day mortality, I can also click on that chevron. I scroll down and you'll see that the average patient receiving this procedure in the AQG training data had a 0.53% chance of death within 30 days. This patient has a somewhat higher risk at 0.78%. Now, I can also ask some questions about this. What if the tumor size is 3.7 centimeters? And so it will actually adjust the inputs and give me a new overall morbidity risk and a mortality risk. And indeed, the mortality risk went up slightly. Okay, that's exciting. That worked pretty well. Now I want to show you what happens if we just copy paste some data. So my next patient is an esophagectomy patient, and I just have a lot of information here. Pretend like this is a clinical note or something that maybe you've dictated somewhere else about your patient, and you just paste all the information in. And this is a 62-year-old female lifelong non-smoker. She's 165 centimeters tall, weighs 88 kilograms, and has stable BMI despite this diagnosis. She has chronic GERD and well-controlled type 2 diabetes. And then there's some more information about labs, the staging for her esophageal cancer, some of the other specific data, neoadjuvant chemoradiation, cross protocol to hopefully downstage the tumor prior to surgery. And there's some information about minimally invasive esophagectomy as the planned course. So now we'll just click enter again, and just like I dictated it aloud, the fields are filled in, and this time all the fields are present. And for this patient, this esophageal patient, it's chosen esophageal, not lung. automatically, and overall morbidity composite. So this patient's slightly higher risk than the average patient, and for the comorbidities composite, and for the mortality is actually less at risk than the average patient. I think she's a little bit underweight if I looked at this correctly. I think you'd see some graphic representations that might help a surgeon, or a surgeon might want to share with their patient.